Uh, Friends, we have a very interesting subject today and very interesting speaker also. And you would have got messages from the president regarding this. We have more than 55 million people across the world who have dementia today. And most of them are in the lower and middle income group countries. Of course, more of that from our speaker, Ms. Vinitha Nair. But in the meanwhile, may I request our president, Dr. Ranjana Banerjee, who has actually uh, listened to her before and address the group today. Dr. Banerjee.
Thank you, Purvi. Good evening, sisters, and welcome, Vinitha, to our If You Are family. It's wonderful having you over today. I was very keen to get you in today or any day for that matter for our members because dementia is so much on the rise with the geriatric community that we need to know and become aware with the beginning and the commencement to identify the disease, the setting in of the disease, and what we can do. How much are we aware as to how to take care of these people and what is the physiological and the psychological impact of this dreaded disease? Never could we imagine, we've heard of great physical disorders, but today I think dementia, depression, delirium, all the 3Ds, they are attack the society to a large extent. And Alzheimer today has become such a dreaded disease in all the families that have elderly people. So we really appreciate you coming over and delivering your vast knowledge in this area. And I think our members will be hugely benefited from your discourse today. So over to you, Vinitha.
Thank you very much.
Ranjana ji, can I just give her introduction, please?
Yes, please, please. Sorry.
Yeah. Friends, I would like to share with you about Vinitha and her background because that is very important for you to understand where she's coming from. Ms. Vinitha Nair is presently a caregiver educator at Patty's Place, which is a dementia care center established by Acclaim Health in Oakville, Canada. She is responsible for educating and supporting families who are caring for a loved one with dementia. She is a postgraduate with a master's degree in criminology from University of Madras and a master of philosophy also in criminology from the same university. She completed another master's degree in criminal justice at Rutgers University in New Jersey, USA. After being a part-time faculty member of police foundations and social work courses at Sheridan College for a few years, Vinitha took up a full-time position with Acclaim Health and has been with Patty's Place for 6 years now. Over to you, Vinitha.
Thank you very much. It's a pleasure to meet all of you online and to have this opportunity to increase our awareness of dementia. And after we talk about dementia and its warning signs, I'll also discuss the 3Ds, as Dr. Banerjee has mentioned, because the lines blur between the 3Ds and it's important to differentiate the similarities and the differences between those or among those. So I'll start by sharing my screen with you. Just let me know, please, if clear and it's visible. Is that good?
Yep. Yes.
I think you can see my phone. Okay. Is that better?
Perfect.
Okay. So for today, I'm going to talk about how we can understand dementia better, exactly what it is, what's the difference between dementia and Alzheimer's disease, what are some of the warning signs, and then we'll talk about the 3Ds of dementia.
Dementia.
Sorry? Okay. So we'll start out with what is dementia. It's a collection of symptoms caused by brain damage. Now, we can have brain damage due to injuries, accidents, falls, concussions, diseases, heart disease, vascular disease, all of that can cause brain damage. So it interferes with normal life because when your brain is damaged, you can't perform the normal functions that we normally do. The reason being, the brain sends signals to different parts of our body. Everything originates from here. So if there's damage to any part of the brain, those signals are disrupted. And in the earlier stages of any of these disruptions, we're able to compensate somehow, whether it's language difficulties or motor skills, we are able to compensate. But as some of these diseases progress, it actually interferes with our daily activities, and we cannot function independently like we used to. So we'll talk about how dementia progresses in different stages in a bit. Now, who can get it? Anyone can get it, men and women equally. It's not biologically geared, but women more, are more likely to get it only because we tend to live longer, and men have a higher mortality rate due to heart attacks and stroke, vascular disease. The popular misconception is that, just like one of our friends asked in the audience earlier before we started, is this more relevant to an elderly audience? Do we need to know this if we're more in that elderly age group? Not necessarily. That's a myth that dementia and Alzheimer's are more, appropriate discussions among the elderly. Not necessarily. It's not necessary that just because you are an elderly person that you will get dementia. There's a lot of us who are very sharp. I don't know how many of you have read that book, Ikigai. It talks about the island in Japan where there is a lot of people who are close to 100 or almost 100 years old and who live happy, healthy lives. It's not a normal part of aging. So there are people who can be diagnosed with dementia under the age of 65. We have people in our day programs that are in their 50s. I run an early onset support group, and what early onset refers to is a diagnosis of dementia under the age of 65. So that's why I have that highlighted. It's not a normal part of aging. Unfortunately, at this time, we don't have a cure. We do have treatment. There is medication that can manage the progression of this disease, but there is no cure at this time. Please feel free to stop me if you have any questions. So what are the stages of progression? Dementia progresses from the early to the middle stage and into the later stages. What those stages refer to are the extent of damage in the brain. So in the earlier stages, it's our short-term memory. The area that's damaged is typically the hippocampus, which is in the center of your brain. This is a slice of the brain that you're looking at. And if you were to, turn it around, that little highlighted part is actually in the center of your brain. And it's responsible for all the file storage related to short-term memory. So that's why when you say things to me, I don't know that you've said that to me 5 minutes ago. Hippocampus is responsible for that information, for storing that information. In the middle stages, the highlighted areas are a little more extensive, which means the damage to the neurons has spread a little further. And now you may see other parts of your life being affected. Maybe your eating habits, maybe your communication skills, maybe your motor skills, maybe your personal hygiene. So it's different for each person. Typically in the earlier and the middle stages, you can still function independently without too much help. Some of us, like I said, we're all different with dementia. So for some of us in the middle stages, we might need help at that stage. And then most certainly in the later stages, you are fully dependent for care on, on a family member or a professional caregiver. So it is an irreversible disease. It does not get better, it gets worse. It's progressive. So once you're diagnosed, a few years later, it has progressed to the next stage, or the damage has progressed further. You will see that in the earlier stages, people are able to continue functioning, and they only have short-term memory loss. But as you go into the middle and later stages, it will affect long-term memories. So in the earlier stages, it's a little puzzling for families that somebody who can't remember a conversation from 5 minutes earlier is able to remember something from 50 years ago. But that's exactly what happens. In the earlier stages, the damage is limited to the hippocampus and the short-term memory part of your brain. All your long-term memories are stored in the outer part of your brain, which is in the later stages, those highlighted areas in the later stages. And it is a degenerative disease. So what's damaged will not regenerate. What you can do is to generate new cells in your brain with activity, with physical and mental activities. So we're going to step into this section, which is talking about the difference between dementia and Alzheimer's disease. Dementia is an umbrella term. It's a very generic term for all of those changes in your cognitive function. Anything related to cognitive impairment falls under that broad umbrella of dementia. There are more than 200 different kinds of dementia. We won't go over all of those. We'll talk about 5 major kinds, which I've got on the next slide. Before we get there, let's talk about some of the dementias in those 200 types can be reversed. Those would be dementias caused by B12 deficiencies, iron deficiencies, infections, urinary tract infections, chest infections, polypharmacy, which is too many medications. So there are certain conditions that cause dementia-like symptoms that can be reversed with medication and treatment, but some are not. And we'll talk about the ones that are not reversible in a bit. So what's the difference between dementia and Alzheimer's disease? Alzheimer's is a specific disease, it's a specific diagnosis. Dementia is not. It refers to all of your cognitive impairment. Any damage to that cognitive functioning, cognitive capacity is dementia. Alzheimer's disease is a specific disease, it's a specific kind of dementia, and that affects your decision-making abilities, your communication, your thinking patterns, your behavior, your mood, all of that is affected. The hallmark of Alzheimer's is plaques and tangles in your brain. The plaques are caused by an accumulation of amyloid protein, and the tangles are caused by an accumulation of the tau protein. So that's the specific, what you see in a brain scan in an MRI, or if you do an autopsy, rather, you will see the plaques and tangles in a brain. And it's the most popular kind of dementia. About 3/4 of people diagnosed with dementia will be diagnosed with Alzheimer's disease. It's named after Dr. Alois Alzheimer, who was the first person to diagnose it. He had a patient in her 50s who had some bizarre symptoms, behaviors when he was treating her. And after she passed, they did an autopsy and discovered the plaques and tangles. So you'll see the top 5 in that umbrella. Under the umbrella, the irreversible kind of dementia are the Alzheimer's disease variety, vascular dementia, for anyone who has heart disease and strokes, you are at a higher risk. Lewy body dementia is an accumulation of Lewy body protein. It looks very similar to Parkinson's disease. So sometimes that's the first neurological diagnosis, followed by a Lewy body presentation. Frontotemporal dementia sometimes is evident in younger people. The frontal lobe of the brain and the temporal lobe of the brain are affected, and those parts are responsible for higher executive functioning. So it's a particularly challenging and difficult one for the family members to deal with. And then we have mixed dementia, which is a combination of Alzheimer's disease and vascular. Sometimes your doctor is not able to say what kind it is. They may just say it's a diagnosis of dementia. Okay, and that's okay too. As long as you understand what you're dealing with, it's much easier. Any questions so far? Okay. So we're going to look at the 10 warning signs of dementia. So how do I know if I have dementia? What should I look out for? If I'm taking care of an elderly parent or an elderly spouse or sibling, or if I'm elderly myself, what should concern me? So I've talked about the memory loss, right? We all have file storage systems in our brain, and we have different kinds of files. Some of us are very good at remembering names. Some of us are good at remembering faces. Some of us are very good at remembering facts. So we have different areas of the brain that are responsible for all of these tasks. And that's why when you go in for a cognitive test, for a diagnosis, the diagnostic testing will actually look at different aspects of your brain function. There's some that will look at visuospatial dimensions. Some will look at mathematical abilities. Some of it will look at just word recall, your verbal functioning. So the memory loss could affect any of these or all of these, depending on where the damage has occurred. So memory loss is pretty much the most obvious symptom. So if I were to ask you what comes to mind when I say the word dementia or Alzheimer's disease, I bet a majority of you would say forgetfulness. And that's the most obvious symptom. How do you know somebody's forgetful? There's a lot of repetition, asking the same question because I've forgotten I've asked you that question. It's not like I'm asking you the same question 100 times to drive you out of your mind. It's because I have forgotten that you've answered, and I think I'm asking you that question for the first time. Each time I ask it, or each time I make a comment, it's the first time in my mind that I'm saying that to you. Okay? Could be as simple as you've just given me a full meal, but I'm going to turn around and tell you, you haven't fed me all day. I'm hungry. So that's how the memory loss presents itself. Not being able to find things, you're constantly searching for things around the house. You've forgotten where you've placed them, right? So that's memory loss. Affecting day-to-day abilities means in the earlier stages, it's simple. We don't have to worry, nothing significant. When you get into the middle or the later stages, you do have to be worried because we are going to forget to turn off the stove. We're going to forget what to do in the bathroom. We're going to forget that when I have a wound, an open wound, I have to dress it before it gets infected. We're going to forget to lock up things. We're going to forget to dress appropriately when we step out of the house. So depending on what stage, okay? So the warning signs are keep an eye out for what kind of forgetfulness you're seeing. Challenges in problem solving, very simple, not able to work numbers, as simple as adding up numbers, writing checks out, simple calculations, not being able to make a simple plan. This is my plan, my work plan for the day, and not being able to follow through. So that's challenges in problem solving. Difficulty completing familiar tasks. The tasks could be as simple as shopping for groceries, going to the bank, walking to the mailbox, going to the temple, going to a mosque on a regular basis. That's my daily walk. That's the route I take. But one fine day, I'm not sure I can do it. I make my tea a certain way every day. I make my breakfast a certain way every day. One fine day, I'm not able to. So, and you will see that happening again when you progress into later stages. That will present itself in different versions. Okay. Disorientation in time and place, not knowing where I am. So that's part of your cognitive test. People will ask, where are you? You will be asked, where exactly are you? What do you see? What is this place? Is it a hospital? Is this your home? Are you able to understand where exactly you are in time and place? What year this is? Who's the prime minister? Who is this sitting in front of you? Is this your wife? How many kids do you have? Is this your older kid? Is this the younger one? Those are questions they ask to see if you are oriented to where you are and what time and place you are, okay? For the reason we talk about the disorientation in time and place is because if I have dementia, I told you earlier that the parts of my brain that are affected are all related, in the earlier stages at least, are related to short-term memories and recent memories. So what happens to me is that I go backwards in time. It's called retrogenesis, which means I go back to a time when I was 15 years old. I remember vividly the house where I grew up, the farm where I used to play, the place where I used to go to school. Right? So that's where I'm at, and I'm going to behave that way. I'm going to do things or say things that are more familiar to me at that time and age. So that's the disorientation we're talking about. Problems with visual spatial relationships, your depth perception, figuring out distance when you're driving, not knowing where the door is, tripping over things. Fall risks are high for somebody with visuospatial changes, depending on, again, which part of the brain is affected. The area that's concerned with vision is in the back of your brain. So if you've got damage, then you're going to see that happen. Not knowing what you're seeing. I've had family members tell me, do you know how scary it was to drive with my husband or my wife, depending on who's been diagnosed, or with dad and mom, because he would stop on the green and move on the red. Or when I'm driving, he would say, watch out, we're going to hit that car, because we can't gauge the distance. Sometimes you will notice those changes with feeding themselves. They might, think they've already got here, but the food's already spilled. You might find more of the food in their laps, on their clothes, or on the floor. Measuring that distance between the table, the plate, and where it's going. Language and communication issues. So that's another obvious one. A lot of people notice that. You go back to your mother tongue. Whatever language you learned first in life is what stays with you. Again, remember, we're talking about the brain. All of what happened to you early on in life is here in the outer part of your brain. So that's the last part to be damaged. The damage is progressing this way. And by the time it gets here, it's going to take a while, a few years. So all of those, what I learned first, the language I learned at home, stays with me. What I learned in school came after that. That was the first input. What I learned in school was the next one. So I'm going to forget that. Okay. So you will find some people lose their ability to communicate in the language they learned later in school and go back to their mother tongue. You may also see, it's called aphasia. Aphasia can be both ways, not being able to communicate what I want to say and not being able to understand what you're saying to me. So there's the receptive aphasia and there's the expressive aphasia. Sometimes I might get stuck. I might not remember the word that I want to say. I might use other words to describe it. I might just pause and give you enough information to fill in the blanks for me. So there's different kinds of communication issues that can happen, just to give you a few examples there. Misplacing objects. You are going to find things in weird places when this happens, because it just doesn't make sense for you to place it there, like finding keys in the freezer or finding food in the bathroom, finding bathroom stuff in cupboards. I had one husband tell me he was very upset, very angry when he came to the spousal support group. And he said, I don't know why she would do that, Vinitha. She actually had wrapped up stuff from the bathroom very carefully in the toilet paper and put it in the kitchen cupboard. And he said, I cleaned out the entire kitchen because it was so smelly and I did not look in the pantry. I looked everywhere else and I found it, and I was so upset that she would do that. This is somebody with dementia who does not know what she's doing. So Misplacing things can be as bad as that. It could go to that extreme, or it could be as simple as misplacing your handbag and then accusing your whoever is living with you, your family members, of stealing those things. Poor judgment is not knowing that you haven't showered. You haven't changed your clothes. A lot of times, this is a very common behavior that family members will report, that my mom gets out of the shower and puts on the dirty clothes again. She'll take it out of the laundry basket. Or she'll say she's showered, but she hasn't showered in a week. And I'm beginning to get that smell from her. Not knowing that I'm listening to the news. This is CNN or the TV saying that there's a flood or a fire or the rain and landslides, accidents. It's happening in another place. I don't have the ability to understand that. I'm going to panic because for me, this is happening around me. And I could be terrified. I could respond to that. I've had people say, I've walked into the room and he is yelling at the TV because there's a lot of conversations happening on TV and he can process all of that. So if you see somebody, when you're out in public, it's too much noise, there's traffic, there's music, there's conversations, can't deal with everything. It's overload on my brain. Think of how your brain works. My eyes and ears and nose, what I taste, what I smell, what I see, what I touch, all of that is processed by the brain. And if the brain is damaged, it's
Sorry, I'll just mute her.
thank you.
Hello, mute everybody.
Thank you. So if your brain's not able to process the sensory output, and I said sensory skills, again, they're all in the outer layer of your brain. Those are the last to go, you know. If I can't process that information coming in, I can't make sense of what's happening around me. I don't know what I'm seeing. I don't know what I'm hearing. Some of us have delusions and hallucinations, so I don't know. If I'm seeing a picture on the wall, I had one daughter say to me, it's really sad. My mother walks up to family pictures on the wall and she talks to them. You know, and I said to her, let her talk to them. If it makes her happy, let her be. As long as she doesn't think that they're harmful. I've had somebody else tell me that her husband has poles and sticks all over the house because he thinks there are creatures on the wall and he will hit them. So, kinds of visual process.
Friends, please mute yourselves. Please mute yourselves. I've
Purvi,
already
you mute
muted.
everybody.
I've already muted. They keep on unmuting themselves. Sorry, Vinitha, please continue.
That's okay. Thank you. So that was talking about poor judgment, right? Withdrawal from work and activities, again, comes back to my ability to hold my attention. I can't focus. If you give me a task, I'm going to go from one to the other. So I want you to finish one task. I can't. And it could be as simple as a coloring page or making something. Help me make the rotis. I've already left the dough and the batter and all of that and moved on to something else. I can't hold my attention because I can't concentrate. It takes a lot of energy for somebody with dementia to start, stay with the task, and complete a task. You help them focus. You need to redirect them and bring them back to the activity. So why that happens is because I can't remember the steps. I can't remember the process that I used to follow. A lot of people have quit jobs because of that. A lot of people have been fired. I had one gentleman's wife tell me that he used to make model trains, very intricate model trains that looked like the real deal. And that was his business. He couldn't keep up with the orders. He had forgotten how to do the models, miniature models of those. So they had to shut down. I had somebody else who ran a very successful construction business. He collapsed at a conference, and that's how they diagnosed dementia. But what had already started to happen was that he was behind. There were a lot of payments. that were not being handled properly. And because his personality was a difficult one to begin with, the family did not discuss it. They went bankrupt. They had to sell it, pretty much everything they had. So withdrawal from work and activities could mean something as simple as I'm somebody who loves knitting or sewing or gardening, chatting with people, making, trying out different dishes. I don't want to do that anymore. I'd rather say I don't want to do it than tell you that I don't know how to do it. So that could happen as well. Changes in mood or personality, that's a big one for most people who are dealing already with other issues like depression or they're on medication. So we'll talk about some of these again when we discuss delirium and depression. So mood and personality could be a significant symptom because there are people who will tell me, Dad was the sweetest guy. And when he was diagnosed with dementia, you just didn't want to be around him. I've had one lady, the sweetest lady when she came to the day program, but when her husband came to pick her up, she would let loose all the profanities possible. He was embarrassed to pick her up, and we had to tell him not to say anything. So how our brain works, right when we are this high, we hear from our parents and grandparents, anybody who's raising us, those are words you cannot say out loud. Okay, so you never ever want to let loose that file. It's always in storage. It's supposed to stay in a closed storage file. What happens with dementia in the earlier stages, you can still remember those appropriate behaviors. The filters are still working, but in the middle to the later stages, the filters are gone. And for some of us, that file, which has been locked in storage, so we just let loose all the stuff that we've been told to keep locked. And that could happen when you see changes in mood or personality. People can become suspicious. People can become irritable, angry, very sad. We have one gentleman who comes to the day program happy. He'll joke with the staff. He passes by my office. I get a wave and how are you? And all of that. And then at the end of the day, when his wife picks him up, he is sobbing. She will call me the next day and say, oh, I had a terrible evening. He cried all evening. So that's what I mean by changes in mood or personality. Any questions before I move on? I see a number in the chat. Should I check before I proceed?
Yeah, you can do that, Vinitha,
Okay.
because people will have questions to ask.
Okay. Ravi, feel free to, just interrupt and tell me if there's something that I've just discussed. And one
Okay.
of the comments or questions is right about what I'm talking about. Okay.
Okay,
I forgot to mention that at the beginning.
I'm so full with this because I've gone through this myself. So it becomes a little difficult. But anyway, I'll definitely do it.
I'm sorry to hear that. I hope this will make a lot more.
I don't know. I wish
sense
I'd
with
met you
what you-
earlier. Anyway,
So could there be the onset of dementia at an early age? Yes. Yes. So I answered that question earlier. Yes, it's called early onset. If anybody is diagnosed under the age of 65, yes, we call it early onset. And it is a particularly challenging one because the person is physically fit. They look like they're physically okay and mentally okay, but the brain's degenerating. So it's hard to deal with that. Is there any reason for triggering the change? So it's to dementia so suddenly that I'm not sure I understand that question. Any reason for? Could you explain that? I'm not sure what you want to say. The first reaction is getting angry until it's explained.
whose question is that?
I don't have a name. I think it says
It's some iPhone. Is that person still here? Is there any reason for triggering on the change in the dementia? Certainly that is frightening for the family. The first reaction of family members is getting angry with the person until it is explained, which is very true. It has happened with us also.
Yeah.
So maybe you'll have to repeat that part of it here.
Okay. Okay. So it's not, generally speaking, it's not hereditary. So just because my mom had it doesn't mean I will have it. Let me explain it this way. If your mom has had heart disease or diabetes or, any other illnesses, diseases for that matter, you are at a higher risk, right? Your risk increases. So for me, both sides of the family, mom and dad have had heart disease. So I am at a higher risk. Mom has arthritis, I have arthritis. Mom has something else, I'm at a higher risk for getting it. But that doesn't mean I will get heart disease. I will have the issue with diabetes. I'm at a higher risk. So same idea with dementia or with Alzheimer's. The difference there, the no part of that's the no part. It's not hereditary. The yes part of the answer is that there is a certain kind of dementia. It's called familial Alzheimer's disease or FAD. And people who are prone to getting that are people who inherit the gene. There is a gene, I believe it's quite complicated to remember the name of that gene. It's APO3 or APO3E4, something like that. It's a complicated name, but that particular gene, genetic component, if you inherit it, your risk is 50% and above. So there's your yes and no. Sorry to be so confusing, but that's just how it is. And the familial kind of Alzheimer's, it's a very small percentage, 5 to 7% of the population that inherits that kind of
Yeah, Gomati, I think, was the person who was asking. Gomati,
Yes.
will you please, yeah.
Yeah. I had asked that question. Since I had put it on mute, I couldn't immediately reply whose iPhone.
Okay.
That's okay. That's okay. Do you want to explain that to me a little bit more, Gomati, so I can answer it more
Yeah,
appropriately?
I have asked whether the triggering of a sudden onset from a person who seems so normal could be from some severe shock she has suffered, or a trauma, or a severe illness recently that has sort of upset her entire system. Could that, I mean, all kinds of research has been done, and the researchers, I mean, I do read about Alzheimer's because I'm sorry to say my sister lives in England has started, and her family is extremely worried. And many of the things you've just spoken seem to fit her so well.
Sorry.
You know, and at first, being her elder sister, when she would talk to me over the phone, repeated, I would be very angry with her and be actually rude, till I realized what was happening, and I couldn't believe it. It really came as a shock that she should, be starting on Alzheimer's. So it's very sad.
I'm really sorry to hear that. It is very sad. And to answer now, I get a better idea of what you're saying. Yes. So in most cases, families are aware. Sorry, excuse me if I'm a little fidgety. I'm dealing with a little problem that involves my sciatica and my nerve root. So most families, especially during COVID, this was very obvious. I had a lot of sons and daughters call me, sons-in-law, daughters-in-law call me and say, this is really weird. One of the parents passed, and now I realize that the other parent has had this for a while, and my parent who passed was covering up, was taking care. We had no idea until we brought mom or dad to live with us, or until we went over to stay with them, and we realized that it's been like this for a few years, but dad never said anything about mom doing these things, or mom never said anything about dad being this way. So a trauma that is losing somebody, the loss of somebody, can be one of those triggering points. And illness, like I said earlier, a heart attack, a major heart attack, a stroke, causing damage, blood and oxygen supply cut off to certain parts of the brain. You will see that. Passing out, blackout. Again, blood oxygen supply. A severe fall. Yes. or an illness that has caused you to be on so much medication that it's actually caused that a damage. So yes, 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 and yes to your question. Yes, I'm really sorry
Thank
that
you.
your sister's been diagnosed. I
Yeah.
hope the family is reaching out for help. UK has a fantastic system for support
Yes.
caregivers.
But
Rashmi, you
tell us
wanted some.
those. Yeah. No,
Rashmi wanted
continue,
something.
Vinitha. Yeah.
I put up my question.
Rashmi, please be louder.
My question is there, at what stage or which is the symptom with bias, one has to worry about or one has to consult a doctor? Which,
Oh, I would say as
Smallest,
soon as you have
smallest.
a concern,
sorry, I'm
as
sorry.
soon as you have a concern, the earlier, the better. We always encourage an early diagnosis because the earlier you detect what's going on, like I said, some of these, it may not be an irreversible dementia. It could be that you're low on thiamine or B12, and it takes care of that symptom. You're low on thyroid, that can cause the symptom. So you want to rule out all other factors before you confirm this diagnosis. And your MRIs or CT scans will show you whether there are parts of the brain that are damaged. But if not, you can do, it's not one single test, right? So at what stage specifically, the sooner, the minute you see changes in behavior, the minute there are causes for concern, I would talk to the doctor. There are blood tests, urine tests, questions they will ask the family on what changes have you noticed, things that have changed around, the person, what is she doing, what is happening. And then you want to do further testing, cognitive
Somebody
testing.
is unmuted. Please mute themselves. Sorry, Vinitha. Sorry.
No worries, no worries. So Rashmi, the earlier the better, because once you know what you're dealing with, now you have the tools to organize, to deal with, and to support that person as well as yourself. Like the whole purpose of doing this, if you know what you're dealing with, you know how to deal with it. That's the whole idea. The whole purpose of creating an awareness of dementia is not to scare the daylights out of you. Definitely not. It's to give you the information so that you have the tools, or you can look for the resources that will help you manage.
The reason why I ask this is not something personal, but in a general, I have seen many of my friends or many of people, 65 and up, they say the same thing. I just forget. I go to the refrigerator, then come back. I forgot what I wanted to do. So that's the reason I was kind of thinking.
So a lot of us do that.
What is that?
That's
Yes,
a lot of us do that.
Is that normal or is that not
Yes.
so normal?
Yes, that's a good question. I'm happy you asked me that question. So there's a difference between what is normal forgetting and what is not normal forgetting. We all age with time.
Yes, yes.
I know this group is full of women who hate to admit that we're getting old. It's okay. So with age, our bones shrink, our brains shrink, our skin shrinks. A lot of things change for us, right? So normal forgetfulness is, I came into this room, but I forget why I came in here. I don't know where I've left my keys. I don't know where I put my glasses down or the book that I was reading. Normal forgetfulness.
Yes.
It's the frequency of forgetfulness. Occasional forgetfulness is okay. It's normal. Frequent forgetfulness, now if it's becoming a pattern, you want to worry about it. The kind of forgetfulness is another one.
Mm-hmm.
What are you forgetting? Are you forgetting important documents? Are you forgetting names of family members? Are you not recognizing your own grandchildren? You don't recognize your son-in-law? I mean, these are things that people with dementia do. Who's this man sitting next to you? Ask him to leave the house. Why is he holding your hand?
Is that a middle stage, right?
Okay, now that's a tough question to answer.
No,
That-
because
Vinitha, I have something to ask.
Yes.
If we keep ourselves engaged, not just physically, but also mentally, things like working out the Sudoku or the puzzles, does it help in keeping the memory active?
Yes.
The cognitive part active?
Not exactly your memory active, your brain active.
Yeah,
It-
cognitive active,
yeah,
yes.
yeah, exactly. So just to answer that question of whether when that happens, is it the middle stage? I don't know. It's hard to say what happens in which stage. Everybody is different. Some of us do this in the earlier stages. Some of us do that in the middle stage. And to come back to what Dr. Banerjee was asking, yes, doing anything to keep yourself physically and mentally active is important because your brain is capable of generating new cells. And that helps with the damage up until a certain point. But once you hit that middle stage or you go past the middle stage, it's not enough to compensate for the damage, right? So
Okay, there are two more questions here. One
Yeah.
is Shweta asking whether vertigo is related to dementia. And Gomati is asking what can one do to ward off getting dementia after you are 70?
Yeah, so I'll put Gomati's question on hold until I finish because I do want to talk about depression and delirium. That would be a general, because there's so much we can talk about on that one, what we can do to prevent and to stay healthy. But a quick answer to Shweta's question, is vertigo related to dementia? Not necessarily. Vertigo is your balance. Your balance is affected for different reasons. It could be the nerve connections going in due to arthritis. It could be something else, tinnitus with your ears. It could be caused by a lot of different things. So I would focus on the cause for the vertigo and then deal with that. I don't believe, not to my knowledge, I'm not medically qualified to answer that. From what I know, I don't believe that vertigo has a direct connection with dementia. Okay, and I'll put Gomati's question on hold until I finish. We'll talk about the preventive aspect after. Is that okay?
Yeah, sure.
Sure, okay. So moving into the next one, it's talking about the 3 Ds of dementia. So I've told you enough about dementia. Keep that in the background of your mind, that's your framework. We've talked about how we forget, mood can change, we lose our focus, we can't complete tasks, we're not able to perceive, what's appropriate, what's not appropriate, what we see around us, hallucinations and delusions, visual depth perception changes. A lot of that happens with dementia. The 3 Ds of dementia, particularly relevant to this group if we're approaching our 60s, 70s, it's depression and delirium. And how do they look like? And what can we do about it? The reason we're talking about that is because for us, as we age, some of us deal with delirium. We experience delirium and depression, and it's hard to tell them apart. So depression looks like this. When your mood is low, most of the time, and there isn't a specific reason, just for no reason, I wake up and I'm like, oh gosh, it's another day and I don't know exactly what to do. And I'm feeling like this all the time. There's no particular reason. There is no particular incident or event, life-changing event that has happened to cause this. I can't get out of it. I can't snap out of this. My mood is this way all the time. And that's not usually who I am, right? It goes with low energy. I don't want to do anything. I don't even want to get out of bed, to do anything. I've had students in my class, and some of them will open up about being depressed. I had one young man tell me, I don't go to any of my other classes. I just don't feel like it, and I suffer from depression. I'm on medication for it, so I just stay at home. Disturbed sleep patterns. For somebody who's depressed, you don't sleep well. You have your circadian rhythm is affected, so you sometimes sleep a lot during the day. You're up at night. You don't sleep very well. You're very restless when you sleep. So that could happen. Feelings of worthlessness, no one cares about me. Why am I here? No one cares about me. There's no purpose to my life. I have nothing to do. I have nothing to contribute to my family, to society. There is no value to my life. I'm not going to eat well, so I don't care if I eat. You ask them if they want to eat something and they're like, no, it doesn't make a difference whether I eat or I don't. So you might see a change in their eating patterns, eating habits, lack of interest in inactivity, just not interested in doing anything. Like I said, even it's fun, even if it's fun, your brother or your friend comes in and says, hey, we're all going to do this. Do you want to join us? No, count me out. Not interested. I'm just going to sit here, curl up and sleep in my room. I don't want to go out. I don't want to see anybody. I don't want to talk to anybody. Don't turn on the lights. Don't put on the music. I just want to sit here in the dark. Slower cognitive functioning. Can't remember anything. I'm not processing what I'm seeing around me. I'm just, it's like you're zoned out. You're not involved. You're not interested. You're not active in what's happening around you. And suicidal ideation. So for some people who are extremely depressed, there's suicidal ideation, talking about it all the time. That's the ideation, the ideas of, not being around anymore, wanting to end my life. There's no purpose, so I don't think I need to be around. That's just the ideation. So there is a difference between suicidal ideation and actually carrying through with that. We won't go there. That's a different topic altogether, and that would be a serious concern. But if somebody mentions, I would talk to the doctor about it. If there's ideas that are being discussed, if there's that thought, the kind of thought going in that direction, then yes, you definitely want to consult a doctor if you're seeing any of these concerns. Sometimes it's loneliness that brings it on, right? A lack of purpose. We used to do things together. So I don't know what to do with myself. Or I used to work and now I don't. I just don't know what to do with my time. I've lost my social network. As we grow older, our social networks shrink. So what am I going to do with myself? And what I would say to that, when we talk about the preventive aspect, staying healthy, is to find a purpose, to find your purpose in life, find something that you can get involved in, whether it's volunteering or contributing to a group, a nonprofit organization, find something that brings you joy, okay? I'll move into delirium because I know we're close to 7. Delirium again. So a lot of the symptoms that we talked about with depression overlap with dementia. If you look at the, a lack of interest in activities, slower cognitive functioning, hallucinations, and disturbed sleep patterns, mood changes. So that's very similar to what you could see with a person who's been diagnosed with dementia. The positive side is that depression can be treated. Some of us need medication. Some of us need to go to therapy. For some of us, the medication is short-term. For some of us, it's long-term, lifelong. That's okay. You need it. Your body's not producing enough, and that's why you need it. Delirium is, again, overlapping. You'll see a lot of similar symptoms: the restlessness, the just not being able to focus on something, sticking with an activity. Sometimes we have hallucinations and delusions, incontinence of the bladder and bowel, confusion and memory loss, not knowing who's here, what time of day it is, where I am, where I'm going. I can't remember things. I can't stay focused. Delirium is very sudden, unlike depression and dementia, which gradually, develop over the years. Delirium is sudden, it's instant, it's a medical emergency. You need to get immediate help. Behavior changes suddenly. So they can't focus, they can't answer your questions. Some of us will slur because of the medication effects or whatever is happening to their system. If you're dehydrated, you can become delirious. There's an altered level of consciousness. I'm not sure where I am. I'm not even oriented to the present time and state and place. And of course, patterns of sleep can change. So you see the overlap between what we were talking with depression and with dementia, a lot of similar situations, similar patterns, which is why it's very hard. But delirium, the difference among these is that delirium is a medical emergency. Depression and dementia are not. Dementia can be treated. Depression can be treated. Delirium can be treated. Delirium and depression are reversible. Dementia is not. So be aware. If you're not sure what it is, go to a doctor. Talk about what you're seeing, what has changed, and what should I do with it. Okay? So this is, I'll wrap up with a little bit of what I do at Patty's Place. This is my office. This is what it looks like. And I'm responsible for working with all the families that have a family member diagnosed with dementia. We have 8 private rooms in the overnight respite part, which is all the way in the back of the building. They're called gym suites. And we have 2-day programs. So what you see closer to the picture is Warmly Club. It's not dementia specific. What you see at the other end of the building is a Soper Club, which is only for people with dementia. And I do a lot of education events, and I do a lot of one-on-one consultations, as well as I host support groups for caregivers. So I'll quickly look at what's on the chat. If there are questions, here's my email if you want to contact me.
Yeah, there's one question from Rashmi, and I think this is what you had addressed also, and
Yes.
Gomati had also asked as to
Yeah.
what you should do to prevent dementia.
Yes,
I think if
so
you
we'll
just-
talk about. Sure. So for a very broad perspective on what you can do to prevent dementia is staying active physically and mentally. Physically, 15 to 20 minutes of activity, walking, playing tennis, swimming, dancing, whatever it may be for you. What is that physical activity that gets your heart pumping? Your brain and your heart are good friends. So whatever gets your heart pumping is good for your brain. But you have to do that religiously to stay active and healthy. You keep your numbers down, keep your weight down. What that means is keep your weight down. So if anyone is at risk for obesity, maintain your weight at a normal, healthy level. High cholesterol, blood pressure, sugar, keep all the numbers down. Regular visits to your doctor, and make sure that you're right on track. Particularly if you are taking care of somebody with an illness or with dementia, you slack off on taking care of your own health, putting your own health at risk. So be mindful of that. Doing things to keep your brain active.
Yes,
Like
true.
what Energy was saying, do Sudoku if you can. If Sudoku gets boring, find something else.
Crossword.
Yeah, so I started with Sudoku. The easy one was very challenging. I cheated a lot to learn how to play Sudoku. And then I moved up the levels. When Sudoku gets boring, find something that challenges your brain.
Absolutely.
The whole key is to challenge your brain. So if you're right-handed, use your left hand. If you're left-handed, switch things to your right hand. Learn a new language. Learn how to play a new instrument. Learn how to play music. Learn how to sing. Learn to dance.
Even cooking. That's very creative.
Yes, so do something that your brain will find stimulating. It can't be boring. Don't sleep. Don't watch TV a lot and sleep. The latest research is pointing to sleep well, get good quality sleep. If you have any hearing loss, get that addressed, because it's putting you at a higher risk for dementia. So wear hearing aids. It's okay. It's nothing embarrassing. So wear hearing aids if you have to. The reason being, your brain will put in a lot more effort to strain, to hear what I'm hearing. What are you saying? What are the sounds I'm hearing? Is that a knock on the door? Or are there ice cubes falling out of the freezer? Or did something drop upstairs? I don't know. So my brain is confused now. If I can hear well, I know what is happening around me, right? If I can see well, say, my dear, get your glasses fixed. So help yourself by doing that. And the latest one also points to zero alcohol. No alcohol, because alcohol causes brain damage. So
It numbs the brain.
Yes. And don't resort to alcohol. If you're depressed, if you're stressed, don't move to alcohol or drugs to help, because they're all temporary. If you don't sleep well, Don't go to supplements. These are all temporary short-term measures. Try to do things naturally, get your body going, get to a gym, go with friends if you have to do it together with a friend. Make sure you stay active physically and mentally. That's the only way to prevent. Whatever happens will happen. You can only prevent things so much, right? But what you can do is you can stay healthy. Let's get screenshots. I think, oh gosh, you want the video to start?
Kindly put on your video cameras on, please. Let's take a screenshot with
For everybody.
Vinitha.
Yeah.
Yes, it will keep us as a memory, as a record.
Yeah, sure. Dr. Sananda Kumari has asked, how do you handle a person, a family member? You have to understand why they're doing what they do. Be very patient, be very kind and compassionate. Make sure you respect them. They're not doing things to bother you. They're not doing these things to bug you. They're not literal or intentional. They may say things very, for example, they don't have the ability to say, oh, Dr. Banerjee's come back from work. She's had a hard day at the university and she's cooking. She's tired. It's all about me, I. You haven't fed me. You haven't taken care of me. I need this. Do this for me. So you have to be able to grow a thicker layer of skin, hear what they say, harsh words, abuses, let it out the other way, or say, that's not very nice. I'm very hurt by the words, or very hurt by what you said. My feelings are hurt. Can you be a little nicer when you say it? Or I'm your favorite daughter. Can you be nice? Do something fun. Redirect the behaviors. Make them laugh. Smile. Even if you feel stressed or irritated or angry, smile when you talk to them. They will go by whatever they see. It's very literal. Remember I said, all the senses work until the very end. What I see, monkey do.
You see, the caregiver also has to tune herself.
Yes.
My personal experience has been that the caretaker is far more, what should I say, far more
Sensitive.
affected by the whole process. Because the person who is affected is affected.
Very, very
Caretaker,
true.
my God.
Yes.
My God.
Very true. And understandably so, Parobi, because I'm in my own world. That's what I call the dementia world. I don't know anything else outside of that world.
Those who
I'm
are
not in
dealing
your
with the
world.
patient become
I'm not in
stressful.
your world. You have to join me in my world to understand what I'm going through. If you think taking care of me is difficult, can you imagine how I'm feeling? I'm stuck. My brain used to function at 100% and I can't. My words are there. Everything is there, but I can't get it out the way I used to. I want my hand to move to pick up the pen. I want my hand to move to pick up the food, but I can't. So just imagine what I'm going through.
Absolutely.
You know,
we can see the degeneration, but there's nothing to do.
The degeneration which comes at suddenly, for the caretaker to watch that degeneration, knowing this person was never, you cannot even imagine what it is to see that degeneration at that split-second moment. The person is doing something and the next moment the person is not able to do that. That for the care, I mean, these things that you only have to go through to understand it.
Yes.
It's impossible
to travel with the person.
Yeah.
Do the patient.
The journey for the caretaker is unbelievable.
It is. Yes.
Malti is trying to say something. Malti,
the patient
you're breaking up. Malti, you're breaking up.
Okay. Do the patients realize that they can't do things, or only the person who sees them realizes?
Yes. So I don't know that I can do certain things. I actually think I'm doing what I used to do. I don't know what I'm doing, which is why it is difficult for my family members to see that. And a quick reminder, I completely validate what Parobi is saying. Yes, for a caregiver, for a family member to see how much mom or dad or your husband, your wife, your brother, your sister has changed, it's very
painful.
hard. It's heartbreaking. But what I always tell a family member is, for your own mental health, think of all the things they can do right now. Focus on what they are able to do and stay focused on things you can help them do. It's a lot of work. And I know that the family support system and the networks here are more extensive compared to certain other societies where it's just a singular unit, right, with two people. And sometimes it is an elderly person taking care of another elderly person with dementia.
Yeah,
It's extremely hard.
Yeah, absolutely.
Yeah.
absolutely.
Really hard.
Yeah. The person
Wonderful
does not
listening to you,
realize.
Vinitha. Wonderful listening to you. You know, this
It
is
was
something
really
which I've
wonderful.
always wanted to hear, because
Yeah.
in our race against this rat race that we are into, many families can have such people. Are we actually thinking about them? Are we considerate towards them, knowing that they are really incapable of so many things? Wonderful,
You
wonderful
know,
to hear. Vinitha.
Ranjanadi, sometimes you have people around you. I always feel that there are a lot of children who have gone abroad and
Yes,
their parents are by themselves. And sometimes
loneliness,
you lose one parent.
absolutely.
I mean, like, I mean, I
And
don't
you see, the
know.
children have moved around not for anything else, but for their career. Now, you cannot hold them back because you are alone. So, there is actually the self training to keep yourself going, is something that each and every individual must master.
Yes.
That's it. It's a lot of thank you to you, Vinitha.
Ranjanadi, before you all end, I would like to say that I really want to thank our speaker today, because I've gone through this not once but twice. My mother-in-law suddenly had dementia, and she used to hide sweets, to the extent that after her death, when I was cleaning out her cupboard, I found sweet boxes packed into small little bits inside her purse.
Can
And
you
we
imagine?
she didn't know what she was doing, I'm
Yes.
sure. And even my father, right at the end, the doctor told me that, now if you look at his brain photograph, I mean, the
scan.
X-ray or whatever scan, it's like the Hawa Mahal. All his cells are dying. And my father was an artist. I just couldn't see it at all. It's very difficult for the
Very difficult.
children
Very difficult.
when this
I'm
happens.
really sorry you
But
had
a
to
lot
go
of
through
it
that
is
twice,
from
Ram.
loneliness. His
Lot
was
of-
loneliness, but I don't know how my mother-in-law, being, with all of us,
Doesn't matter,
Just
Shamustri.
happened.
It can
I
happen.
think she was suffering from losing her husband,
Maybe,
that
maybe.
created that shock it created. Thank you.
Gomatidi, are you here for the vote of thanks?
Thank you very much.
She was
Gomatidi?
here, I think. Gomotidi?
Gomatidi?
Yes, iPhone. I can see iPhone.
Yeah, please unmute. Yeah,
I'm right here. I'm right here.
Please
get
give
your
her a,
video on. Please get your video.
yes, put
Uh,
your video and give her a wonderful talk, Vinitha. Thank you so much.
Oh, absolutely. It's such a pleasure. Thank you for hosting and having me.
Yeah, Vinitha, I think we've all been very privileged, and I think it's the right time for us all to sit up and take a kind of a note of our own state of being, because our lives are very busy. I think most of us are still active, but for those who have retired and the 2 years of COVID did give a kind of a setback to personalities who otherwise would have been what would call a joyful, cheerful person. A kind of a depression did set in, and maybe in many cases of people, that's why I asked you what could have triggered sudden bringing on. It could be this the global depression that came upon, not because you were suffering from COVID by itself, but because of the atmosphere around you being locked up at home.
Absolutely.
Yeah. And so this, and for a person who is very active, very sharp, very intelligent, to slowly disintegrate before your eyes, it's a most tragic evolution,
Yeah.
So I think all of us need to be especially attentive now to ourselves, because I think Many of us may have lost our spouses. So we need to take care, and our children are all abroad and may not come in a hurry, you know. So we have to be extra careful of ourselves, our mental abilities, and let our family doctors know if we ourselves notice any change in us.
Yeah.
I think we are very lucky today to have had this evening with you, Vinitha.
Thank you so much. Very, very touched by your words. And I think you hit upon a very sensitive topic, which is being lonely and being isolated as you
Yes.
get older, right? So form
Yes.
your own networks, form your friendship networks, form activity groups that you can, you get together because you enjoy bonsai. Do it together. Get together because you enjoy knitting or quilting or gardening. Find something that you can, gather
Engage
around
yourself.
with people, even cup of tea together with people, because socialization is one of those things. You got to remember all that gossip and what she said about the other person. And,
Yes.
it keeps your brain sharp. I'm not encouraging gossip, but what I mean is I'm encouraging the socialization.
And
That's
you're
what-
keeping it active.
And I think this WhatsApp is such a wonderful invention for all of us, because we keep ourselves connected, we form groups with like-minded people, enjoy going out, meeting, having a cup of
And
tea
we are
together.
extra chatting.
Yeah, and chit-chat every day on the phone,
Yes.
on messaging, you know.
Yeah.
It's just wonderful. Maybe not so much for the growing up kids or teenagers who are glued to their telephone. They are the bane of teachers in classrooms. but I think the kind of WhatsApp messages we get, form groups, be together, all you
Yes.
old people. So it's very good, Vinitha.
Very
I
good.
think we are living in good times and bad times. Thank you so much on
Thank you
behalf
so
of
much.
the IFUWA. I thank you.
Thank you so much,
Thank
all
you
of
so
you.
much. It was
Thank you
very
very much.
enlightening.
Very
Thank you.
nice.
Great. Happy to have done this with you.
The very first day when I heard her, I said, I must get her here. You fulfilled my dreams. Thank you, Vinitha.
Well, absolutely. You're very welcome. More than welcome. I'm happy to continue to be in touch with this group. And if anybody needs to,
Sure.
have any
Really.
conversations or anything else in future, please feel free to let me know. Thank you
All
so
right.
much
Thank
for all
Thank you
your
so
Thank
much.
you so
comments
much.
in the
Thank
chat
you and
box.
good
Thank
night.
you.
Bye
And
bye and good
have a
night.
safe trip to
Thank
Canada.
All of you,
Bye.
bye-bye.
Thank you.
Thank you.
Thank you.
Thank you.
Bye. Should
Love
I
you
log
all.
off? Yeah.
And
Bye
have a
bye.
yes, you can log off. Have a safe trip to Canada.
She's logged off, I think.
Yeah,
And she's
no.
logged.
Okay.
Good. No, at a
Bye.
time we had almost 32 people.
Yeah.
Yeah, very
So
good.
I'm surprised people didn't come because this is a very, very topical subject.
Very topical, and she did it very well.
Yeah.
Yeah.
Okay,
Okay,
take care.
good
Thank
night.
you. Thank
Good
you,
night.
Gauri. Good
Bye-bye,
night.
all
Good
of
Madam
you.
night.
Good night.
President, thank you, everyone. Thank you.
Thank you. Bye.
Thank you.
Bye.
All of
Log
you,
off.
bye.
Log off now. Close it.